We actually oversee about 200,000 investment professionals in Pennsylvania here alone, about 200 banks and credit unions, that's the headquarters, not the branches, and about 20,000 other financial service firms, which includes everything from marketplace lenders and mortgage servicers or mortgage providers to cash advance places. So that's our job as a regulator. But as a regulator, we're uniquely qualified to offer financial education and outreach. So we focus our financial education and outreach on three primary things. The first thing we do is, while a lot of organizations offer personal finance, and we know many people need a better grasp of personal finance, we focus on those areas and those venues where there has to be a non-commercial presence because we aren't selling anything, there's no affiliations or ties. So for example, in many organizations, we're the only place that's allowed in to provide some basic financial education because of our non-commercial presence. The other thing we do is consumer protection. As a regulator, we're on the front lines of fraud and abuses and even just mistakes that people make that we want to let our industry partners know about. And then the third thing we do is investor education. The personal finance spectrum ranges all the way from needs versus wants and basic budgeting to some sophisticated investor education information that people need to know in order to be able to save and invest wisely. So we do those three primary things. Now to talk to you about two specific programs is my colleague Tina, and she's going to talk to you about Senior Safe and EV Legal.
Let's see if this works here. Okay, can everybody hear me okay? Yeah. Okay, so my supervisor came in today. He wasn't here yesterday. I was able to be here. And he said to me, so we're going to go last? And I said, yeah, and there's good things about it and bad things about it. The good things are that I heard everything that everybody has had to say. And the bad things are that everything that I was going to say is out the window, right? Isn't that what happens? So, but it's all good because I can connect the dots now after hearing what everybody's had to say. And as Brian had mentioned, we are more about preventative medicine. As the regulator, we can't be there when that person is being pitched a potential scam. But what we can do is try to get to them before the con artist does through education. So our two goals in the sense of what we're doing today is education for prevention, because we all know that once that money is taken from the individual, it's gone most of the time. Some offshore account, it's already spent. And the other one is early detection. So if we can detect it a little more sooner than we have been, we can close the gaps in reporting, because so many of our agencies do work together, but oftentimes our agencies may not know who to call, especially law enforcement. So law enforcement is super busy with murders and all of those other grisly types of crimes. When there's a financial crime though, they can give us that information and we can help them so that their plate is not as full. So education for prevention as well as early detection. So let's go directly to what are we doing about it. One of the programs is called EFI, horrible acronym I know, Elder Investment Fraud and Financial Exploitation Prevention. We're talking about individuals who may not be able to help themselves because they are unaware that they are being exploited. So we usually educate those individuals through different programs, but now how can we help those who cannot help themselves or not in a position to help themselves? We have been educating healthcare providers, doctors, nurses, geriatric care managers on how to suspect and report elder financial abuse. We've been able to do that through a grant from the Investor Protection Trust, through this EFI medical program. And if you saw outside, there were some materials out there. A clinician's pocket guide that should fit nicely in a doctor's pocket, as well as the patient education flyer, which can be placed in doctors' offices for patients or their family members. There were pilot programs developed in Pennsylvania. We trained medical professionals, and this is the real goal, is for doctors to know what they're looking for, where they can report. Now, we realize that doctors are not the only people on the front lines when it comes to this type of service to seniors, so we extended it to include attorneys. So now we're offering, in addition to the continuing medical education courses, continuing legal education courses. And here's a survey on professionals. Now, I know that yesterday there was talk about there's no good research that proves that education helps to affect behavior, right? But let's think about why there probably isn't any research. Are we going to be there the moment a senior citizen is talking on the phone with a con artist and perhaps hangs up because they remember a message we delivered, or did not sign on the dotted line? How exactly do you measure that? So when we're talking about that, we need to keep that in mind. And somebody said yesterday, don't confuse data with reality. So the legal pilot program, the American Bar Association, it's important to partner with the right people, but on a national level and a state level. Why educate lawyers? Again, I don't think that I need to tell you why, because we've talked about that in the past 2 days. But the pilot program is happening in Pennsylvania. There are CLE courses that will be scheduled, and I'm happy to report that we had an advisory committee meeting last week. Dr. Karlowish is a member, as well as many of the people in the audience today, which I'm very pleased about, because we want to make sure when you're doing a state-specific program and outreach that you have the right people at the table, and also that you're aware you're not the only one doing this, so you want to make sure that everybody is with you doing it together. Why duplicate efforts? Bring everybody together to make things stronger. So, I know Kai had presented a little earlier, and he had said we should hit it from both angles, so I'm happy to say that you did say that. You said we have to go up both angles. So, healthcare providers and financial services professionals should be educated. So, this is an introduction to the Senior SAFE program. The CFPB was talking earlier as well about how they have some guidelines, Naomi, and we actually developed a program through the state securities regulators. There's a state securities regulator in every state, and it's a toolkit. The training is already available. It began as training for bank representatives, bank tellers, and now it's also for broker-dealers and investment advisors. And what this aims to do is, again, educate those people on the front lines that see senior citizens more directly on a day-to-day basis, more so than we ever do, no matter how much messaging or outreach we can achieve. And it's a PowerPoint, but there's also materials also that go with this program. And here's just some samples of what the PowerPoint looks like. What I think that financial firms will like about this is that they don't have to develop their own program. This was vetted by state securities regulators and other federal organizations, and it's basically everything you need there. Confidentiality, we have the advisory committee that's helping us with that, and state reporting. So we are all able to customize per our state's laws and reporting methods. We talk about the goals of the training, and then here's some of the resources that are available. So there's resources that the bank tellers can actually have in front of their desks there that they can give to clients or customers. And then there's also a quick response chart. So what's really important is not just educating the customers, but what is the system in place? We need to make sure that all of the reporting, everybody knows who to go to in these scenarios. And I'm going to ask Brian to come back up and talk about a little bit more in general about what we do as an agency in addition to these two programs.
So to put this in context, Tina's a wonderful presenter, but until we overcome some basic physical limitations, I haven't figured out how to get her in 2 places at once. So reaching 13 million Pennsylvanians across our vast state with its geography and topography becomes a real challenge. And we could try and create a program where we could be in every community, but even then we have a problem with timing, right? So we have this theory of just-in-time education, that talking to somebody about an issue that they won't face for months or years can be really problematic. They may or may not recall it. But as Tina said, how do you measure a negative? How do you measure that somebody didn't make a wrong mistake? So what we really want to do is get into the communities with the professionals that older people really, really see. So we have 4 initiatives that we help do under this Consumer Financial Protection Initiative. One is obviously protecting people against easy money scams. So we're working with nonprofits, organizations, government agencies. You might know them as payday lenders. But these can be terrible, terrible debt traps. gaps. You know, a $500 payday loan to get you through, if you refinance it for a year, can cost $2,100. That can really, really hurt our seniors and anybody for that matter. I mean, these things can be really problematic. Now, for the most part, a lot of the payday loans aren't legal in Pennsylvania, or they're unlawful, I think is the correct legal term. So they're unlawful in Pennsylvania because of our interest rate caps, but that doesn't mean that there aren't unlicensed lenders. The other one is preventing financial abuse. You've heard about 2 of the programs. It's important to mention these are real programs that we're actively launching to reach real professionals, medical and legal professionals, as well as people in the financial services sectors on the front lines. So this isn't a program for the CEOs that we hope will trickle down through their organizations. This is for their staff. We're trying to help people save for retirement, and the other one is, in order to help us do all this, we're establishing a financial information exchange, which is where the title of the presentation comes from, right? So when I first got there, one of the first questions we asked was, well, we have some great materials, but I'm pretty sure I've seen something like this somewhere before. So Pennsylvania Treasury has some stuff about saving for college, 529's accounts. The Housing Authority has some information on mortgage and credit counselors. And FIA has information on saving for college. And one of the first things we wanted to do was say, stop. We don't want to recreate the wheel. We certainly don't want to duplicate anything. But we also found some real and significant gaps. None of us had information on basic consumer cybersecurity that was a consistent message to all of our stakeholders. And oftentimes, some of our call center people didn't know where to refer calls. We didn't even know that an agency did that thing, or that they're, in one case, somebody didn't even know that the Department of Banking and Securities didn't exist. This is somebody who has served 20 years with the Commonwealth and legitimately didn't know. And it's not a criticism. Sometimes we just get so busy that we don't know. So over 20 Commonwealth agencies are getting together to essentially approach what we call the no wrong door problem. So when you call 1-800-PA-BANKS, we might be able to take your call and actually answer your question, to check the background on a professional, or take your complaint. And if we can, each year we typically refer complaints to over 20 different federal agencies, everything from the Commodities Futures Trading Commissions to the Consumer Financial Protection Bureau to other agencies if it's appropriate, or back to the financial institutions or to a community resource. So that's what we try and do. We're working with other call centers around the state so they know what we do and we know what they do so we can get them to the right place. So that's the Consumer Financial Protection Initiative in the context of exactly why we're doing what we're doing.
And I promise I'll be quick so we stay on time. AARP is here. I just wanted to let you know that we do want to strive to achieve that multiplier effect. So because we as individuals can't be everywhere all at once, we've been working with AARP for 9 years on the campaign for Wise and Safe Investing. Again, we get grant funding, so it's not taxpayer dollars. And what we do is we have a consumer issues task force, which is comprised of 15 senior citizen volunteers who are real consumer advocates. One's a former school teacher, the other one worked in government, really educated. There are fraud fighters. They go out to their communities and spread the message on how to be wiser and safer investors. We're trying to keep things interesting. Investment fraud bingo. I know it sounds funny, but when I first started working at the Securities Commission at the time, I couldn't figure out how to get on the agendas of the Area Agency on Aging or senior centers. So I looked at their agendas and thought, okay, what would I sign up for to do? So bingo. What we did was we have a special version of investment fraud bingo whereby when the caller calls out the number, there's a message with it. It's usually a message about the red flags of fraud or who to call if you think that you're a victim of fraud. And there's repetition going on as well. The message is done differently. If we're in a particular area in Pennsylvania, we'll also talk about particular cases in that area so that they are familiar with what's going on and what kind of frauds are out there. Again, we're trying to keep it lively, interesting, creative. If I'm going there and my presentation is going to be called Fraud Prevention, it is a downer. Nobody's going to want to hear about that. But this involves prizes as well, which is motivation. It's the little things, as somebody had mentioned before. And then, of course, we have a host of publications available free of charge to groups. I do encourage you to go on our website, and we have social media presence, PA Investor Education, and our website is www.dobs.pa.gov. And Brian, I wanted to give you the chance to close up the conversation.
We encourage everyone to call 1-800-PA-BANKS. It's pretty easy to remember. So if you have a question or you're not sure where to call there. We'll help get you to the right place. And definitely, our tagline has been connect, learn, and contact. So connect, follow us so you're aware of the most recent scams or where we're going to be. We have information to learn, and then contact us. Call 1-800-PA-BANKS. You can fill out an online form or just give us a call. The important thing to note about that number is there is no phone tree. We might be the only agency in the Commonwealth that when you call, an actual person picks up and answers the phone. There is no phone tree, and that's deliberate. If occasionally we're really busy, you'll end up getting voicemail, but we will call you back. So there's a real live person at the end of that.